Obesity affects nearly half of American adults, yet the common narrative of just eat less and move more completely misses its profound biological and environmental complexities. This isn't a simple issue of willpower or character. It's a chronic, complex health condition shaped by an intricate web of factors, from our genes and hormones to the food environment around us. Rachel, you've deeply studied this topic. Can you start by helping us understand what obesity truly is, beyond the simplistic view?
Absolutely, Walter. At its core, obesity is a chronic condition where excess body fat begins to negatively affect health and daily life. We often hear about BMI, or body mass index, as the primary measure. It's calculated by dividing an adult's weight in kilograms by their height in meters squared. A BMI of 30 or higher is classified as obesity, and 40 or higher is often termed severe or class 3 obesity. But it's vital to understand that BMI is really just a screening tool. It doesn't tell the full story.
So BMI is a starting point, but not the definitive answer. What else should clinicians consider then if BMI alone is insufficient?
Precisely. A muscular athlete and someone with a lot of internal fat could have identical BMIs, yet their health profiles are dramatically different. Good clinicians look at much more: waist size, specifically where fat is stored, blood pressure, blood sugar, cholesterol, sleep patterns, mood, mobility, family history, and even current medications. Fat around the organs, called visceral fat, is generally more problematic than fat stored on the hips or thighs. The key takeaway is that obesity isn't just about the number on the scale. It's about how your body is functioning. And this isn't to say all body fat is bad. We actually need fat. It stores energy, helps regulate hunger, influences insulin, and even communicates with our brain, liver, muscles, and immune system. Think of it almost like an organ. Problems arise when we store too much of it, especially viscerally, and it disrupts normal body processes.
That's a critical distinction. It sounds like our understanding of fat itself needs an update. But if our biology hasn't fundamentally changed, why has obesity become so widespread? The CDC reports roughly 1 in 5 children and 2 in 5 adults in the U.S. live with it. This isn't a coincidence, is it?
It certainly isn't. Our biology is largely the same as it was decades ago. But the environment around us has changed dramatically. Calorie-dense, ultra-processed foods are cheap, heavily marketed, and designed to be incredibly hard to stop eating. Restaurant portions have ballooned. Sugary drinks are ubiquitous. Many of us now sit for long hours at desks, in cars, and in front of screens. Neighborhoods often lack safe sidewalks or parks. Stress, irregular schedules, and glowing devices make quality sleep harder to come by. The world we live in makes weight gain easier and weight maintenance harder for many people. It's not a personal failing. It's the environment interacting with normal human biology.
So it's almost like our environment is engineered to promote weight gain, which puts incredible pressure on our ancient biology. Moving deeper, you mentioned the balance getting thrown off. What's happening internally when someone gains weight, and why is it so hard to maintain weight loss?
Weight gain at a very basic level occurs if you take in more energy than you burn. But the real question is why that balance shifts. Our brain truly runs the show. Hunger, fullness, cravings, and even our resting metabolic rate are controlled by a complex interplay of signals between the brain, gut, fat tissue, and hormones. When someone loses weight, the body often fights back. It can increase hunger, slow metabolism, and push weight back up. This isn't a sign of weakness. It's ancient biology trying to protect us from starvation. That's why maintaining weight loss can feel incredibly difficult for many.
That sounds like a powerful biological imperative working against us. Beyond just calories, you also highlight the importance of food quality. How does that factor into this complex picture?
Calories definitely count, but the type of calories matters significantly for long-term health. Ultra-processed foods, which are high in refined starches, added sugars, unhealthy fats, salt, and industrial additives, are easy to overeat and are also often linked to greater weight gain. In contrast, meals built around whole foods, vegetables, fruits, whole grains, beans, nuts, lean proteins, and plenty of water tend to support better fullness, steadier energy, and overall health. You don't need a perfect diet. Small, practical shifts like choosing water instead of soda, eating more slowly, adding a vegetable to every meal, or ensuring enough protein and fiber can make a real difference over time.
And movement, I imagine, is just as crucial, not just in terms of formal exercise.
Exactly. Movement is a key player. It's not only about gym workouts. Physical activity encompasses walking to the mailbox, taking the stairs, dancing in the kitchen, gardening, or simply standing more than sitting. Our modern lives have become far more sedentary than even a generation ago. Regular movement improves mood, sleep, insulin sensitivity, heart health, and energy, even if the scale doesn't change dramatically at first. The best approach is to start where your body is now, whether that's short walks, chair exercises, or water workouts, especially if joint pain or limited mobility is a concern.
We often hear it's all in your genes. Is that true, or is there more nuance to the role genetics plays?
Genes do play a role, Walter, but they are absolutely not destiny. Some rare, severe forms of obesity that appear very early in life are caused by a mutation in a single gene, like the leptin gene, which affects energy balance regulation. However, the vast majority of obesity cases, affecting over 42% of Americans, are far more complex. They result from the combined influence of more than 100 different genes, each contributing only a small effect rather than a direct cause. Genes like FTO and MC4R are known examples that can increase susceptibility to weight gain. But these genetic factors don't act in isolation. They interact strongly with diet, physical activity, sleep, stress, and our environment.
So, while genetics loads the gun, so to speak, lifestyle still pulls the trigger.
That's a good way to put it. Twin studies reinforce this. Even when separated at birth, people's BMIs tend to resemble their biological parents more than their adoptive families, highlighting genetic influence. Yet, a major study in July 2024 showed that strong lifestyle habits can meaningfully counterbalance even a higher genetic risk. Someone with a genetic predisposition might need to work harder through consistent physical activity, whole unprocessed foods, avoiding fast food and smoking, and moderating alcohol to manage their weight. But lifestyle choices and surroundings still matter enormously, and genes are far from an inevitable fate.
And sometimes there are clear medical reasons for weight gain that have nothing to do with diet or exercise. Can you elaborate on those?
Absolutely. Conditions like hypothyroidism, where the thyroid hormone is low, Cushing's syndrome from too much cortisol, polycystic ovary syndrome, or issues in the hypothalamus can all shift metabolism and appetite. Certain medications, including steroids, some antidepressants, antipsychotics, and beta blockers, can also contribute to weight gain. The crucial message here is never to stop a prescribed medication on your own. Talk to your doctor. They can often adjust doses, switch medicines, or help manage side effects.
Beyond medical conditions, how do hormones, stress, and sleep influence weight?
They are huge, Walter. Hormones like leptin tell your brain you have enough stored energy, while ghrelin ramps up hunger. Insulin moves sugar and affects fat storage, and sex hormones influence where fat is distributed. Chronic stress and poor sleep can increase cravings, lower energy, and make healthier choices much harder. It creates a vicious cycle. Stress leads to poor sleep, which leads to stronger hunger, less activity, more weight gain, and even more stress. Breaking that cycle often needs more than just eat better advice. It can mean better sleep routines, stress management tools, mental health support, and practical help from family or community.
It seems like we're constantly circling back to the idea that individual responsibility is only one piece of a much larger puzzle.
What about social determinants and how they impact a person's ability to manage their weight?
Those are absolutely critical. Social determinants are the real-life conditions people are born, grow, work, and age in. Food insecurity, low income, limited access to fresh groceries, unsafe neighborhoods, a lack of parks or sidewalks, discrimination, and chronic stress all significantly raise the risk of obesity. Telling someone to just eat healthier when they live in a food desert, work 2 jobs to make ends meet, or can't safely walk outside isn't helpful, and frankly, it's dismissive.
Real solutions require both personal strategies and community-level changes.
That context is essential. Let's also be honest about the health risks. What are the most significant complications associated with obesity, and how do they develop?
Obesity significantly raises the likelihood of developing serious health conditions, including heart disease, stroke, type 2 diabetes, high blood pressure, certain cancers, fatty liver disease, sleep apnea, osteoarthritis, and depression. These risks stem from multiple interconnected mechanisms. Excess body fat, particularly visceral fat, the deep abdominal fat surrounding organs, acts as an active endocrine organ. It releases pro-inflammatory chemicals and free fatty acids into the bloodstream, driving chronic low-grade inflammation and insulin resistance throughout the body. Insulin resistance occurs when cells become less responsive to insulin, leading to elevated blood sugar, and the pancreas overcompensates, eventually contributing to type 2 diabetes.
So it's not just about the mechanical burden of extra weight, but also an inflammatory response.
Exactly. That inflammation and insulin resistance damage blood vessel linings, raise blood pressure, and promote plaque buildup in arteries, increasing the risk of heart disease and stroke. Visceral fat also floods the liver with fatty acids, promoting fatty liver disease. Cancers are promoted through this chronic inflammation, elevated insulin, and increased estrogen from fat tissue, which can fuel tumor growth. Osteoarthritis develops from both the mechanical stress on joints and the inflammation that accelerates cartilage breakdown. Sleep apnea results from excess fat in the neck, causing breathing pauses that worsen oxygen deprivation and heart strain. And depression is linked through both inflammation affecting brain chemistry and the stigma, reduced mobility, and sleep disruption associated with obesity.
That's a sobering list of risks. But is risk the same as destiny? Does everyone with obesity develop these complications?
No, risk is not destiny. Not everyone with obesity develops every complication. The severity depends on factors like the amount and distribution of fat, the duration of obesity, genetics, and overall lifestyle. Many of these conditions can be managed, improved, or even prevented with sustained weight management, healthy eating, physical activity, and medical care that targets underlying mechanisms like inflammation and insulin resistance. Early intervention makes a big difference.
And when it comes to children, the approach must be even more sensitive.
It truly must. Children's bodies are still growing. The goal isn't shame or crash diets, but supporting healthy growth through family meals, enough sleep, enjoyable movement, less sugary drinks, and, crucially, reducing bullying. Children with obesity are more likely to carry it into adulthood and face earlier risks, but supportive environments make a monumental difference. For those with severe obesity, where BMI is 40 or higher or 35 with serious related conditions, daily life becomes much harder. Joint pain, sleep apnea, and mobility issues intensify, but it's not hopeless. Treatment often needs a full team approach.
That brings us to weight stigma. It seems like a pervasive issue even in healthcare settings. What's the impact of that stigma?
Weight stigma is the unfair treatment, teasing, and discrimination people face because of their size. It happens in schools, workplaces, media, and unfortunately, even in doctors' offices. Stigma doesn't motivate, it harms. It increases stress, depression, avoidance of medical care, emotional eating, and isolation.
Respectful language matters deeply. We say a person with obesity, not an obese person, because a person is never defined by a diagnosis.
Given all this complexity, how do doctors evaluate and treat obesity in a comprehensive way?
A thoughtful visit goes far beyond the scale. Doctors will measure height, weight, waist circumference, blood pressure, order blood work, and ask about sleep, eating patterns, medications, family history, and life circumstances. From there, they build a personalized plan. Treatment is not one size fits all. It's more like a ladder. Some people do well with realistic nutrition changes, more movement, behavior support, and better sleep. Others benefit from prescription medication. And for some with severe obesity or serious complications, bariatric surgery can be life-changing.
Medications have been a big topic lately, particularly GLP-1 receptor agonists. How do these newer drugs work, and what kind of results are people seeing?
Newer GLP-1 receptor agonists and dual agonists represent a major advance. Medicines like semaglutide, marketed as Wegovy, and tirzepatide, known as Zepbound, mimic natural gut hormones. They slow stomach emptying, powerfully reduce appetite and cravings, promote feelings of fullness, and improve blood sugar control. Tirzepatide goes further as a dual GLP-1/GIP agonist, often delivering even stronger results. Clinical trials show people on the highest doses of semaglutide typically lose around 13% to 17% of their body weight over 1 to 2 years, while tirzepatide users achieve 20 to 22.5% on average. These are substantial, sustained losses that can meaningfully improve or resolve obesity-related conditions like type 2 diabetes, sleep apnea, and high blood pressure. They work best when combined with eating and activity changes, and have helped many achieve significant weight loss when lifestyle measures alone weren't enough. Newer daily oral pills like orforglipron also offer similar benefits without injections.
Many still perceive using medication for weight loss as cheating. How do we counter that narrative?
It's important to understand these are legitimate medical tools. No more cheating than insulin for diabetes or statins for high cholesterol. Obesity is a chronic, complex disease with strong biological drivers, and prescription medications address those underlying mechanisms. They do require medical supervision, though. Common side effects are mostly gastrointestinal: nausea, vomiting, diarrhea, constipation. Less common but more serious risks can include pancreatitis, gallbladder problems, and kidney issues, so ongoing follow-up with a healthcare provider is essential.
And bariatric surgery for those with severe obesity?
Bariatric surgery, like gastric sleeve or Roux-en-Y gastric bypass, reshapes the digestive system. It reduces stomach size, lowers hunger hormones, increases satiety hormones, and can alter nutrient absorption. This leads to powerful, often long-lasting weight loss and metabolic benefits. It's typically recommended for adults with a BMI of 35 or higher, or 30 to 34.9 with serious obesity-related conditions who haven't had sufficient results from lifestyle changes and medications. Candidates must be committed to lifelong follow-up. Benefits can be transformative, with people often losing 20 to 35% of body weight and seeing major improvements or remission in conditions like diabetes and sleep apnea. It enhances both quality of life and longevity. However, it's not an easy way out. It requires lifelong commitment to proper nutrition, daily vitamins, exercise, and medical checkups. For the right person, it can be life-changing. But a thorough discussion with a bariatric specialist is essential.
One of the most frustrating realities for many is that even after significant weight loss, the weight often comes back. Can you explain why that happens?
This is a truly crucial point, Walter. After significant weight loss, your body frequently fights to regain its previous set point. It can ramp up hunger hormones, slow down your metabolism, and reduce daily calorie burn, all in an effort to defend the weight it's used to carrying. This biological pushback is incredibly common and well documented. If your weight has returned or is starting to creep back up, you are not alone. Studies show the majority of people who lose weight through diet and exercise regain at least some of it within a few years. This isn't a personal failure or a lack of willpower. It's a normal physiological response. There is no shame in it. What it does mean is you may need to shift into a more deliberate, long-term management mindset, just like people do with other chronic conditions, such as high blood pressure or diabetes. Obesity and weight regulation are often ongoing conditions that benefit from sustained support rather than one-and-done solutions.
That recontextualizes the entire struggle for so many. Let's quickly bust some common myths then.
Myth 1. Obesity is just laziness. False. It involves biology, genes, hormones, environment, stress, medications, and more. Myth 2. If people really wanted to lose weight, they would. Many have tried repeatedly. Biology and life circumstances get in the way. Myth 3. All people with obesity are unhealthy. Risk is increased, but health varies widely. Myth 4. Thin people are always healthy. Not true. Anyone can have poor habits or hidden conditions. Myth 5. Weight loss medication is cheating. No more than insulin for diabetes or statins for cholesterol. And myth 6. BMI tells the whole story.
It's a starting point, not the full picture.
So, with all this in mind, what can schools, families, and communities do to support a healthier environment? And when should someone seek medical help?
Schools can offer nutritious meals, water access, safe activity, and zero tolerance for weight bullying. Families can focus on shared meals, less sugary drinks, enjoyable movement, and kind language about bodies. Communities can build sidewalks, parks, affordable healthy food access, and reduce stigma in healthcare and workplaces. If you're supporting someone struggling with weight, ask, "How can I support you?" Or "Want company on a walk?" Or state, "You deserve respectful care." Avoid unsolicited diet advice or comments about their body. Kindness and practical help reduce stress and open doors. You should seek medical help if you have rapid or unexplained weight gain, shortness of breath, chest pain, loud snoring, high blood pressure or blood sugar, joint pain limiting movement, depression or anxiety around weight, or binge eating patterns. Early, compassionate care makes a difference.
Rachel, this conversation has truly highlighted that obesity is a chronic, complex, and treatable condition, shaped by far more than just personal choices. Our understanding needs to move past blame and towards empathy and evidence-based solutions, recognizing the roles of brain signals, hormones, genes, modern food environments, sleep, stress, and societal factors. If this episode helped you see obesity with new eyes, consider sharing it with someone who might benefit from this perspective.